She was just a nursing student on rotation. The senior doctor never bothered to learn her name. The nurses handed her a mop and pointed her toward the dirty rooms. Nobody asked where she came from, what she had done, or what she had left behind. Lee Caldwell wore loose blue scrubs, kept her eyes low, and stayed invisible, exactly the way she had planned it when she walked away from everything she used to be. Then military trucks rolled through the parking lot of a small rural hospital, and 4 Navy SEALs carried a broken man through the front doors screaming for someone who didn't exist anymore. The team leader swept the room, and when his eyes landed on the quiet woman standing in the back of the hallway, he stopped breathing for half a second. Then he called a name, out loud, in front of everyone. What happened after that call surprised every single person in that building. If this story already has your heart racing, hit that like button and drop a comment right now telling me what city or state you're listening from. I want to see how far this one travels. Subscribe and stick around, because every story on this channel is built for people who know that real strength does not announce itself. Let's go. You missed a spot. Dr. Hammond said it without lifting his eyes from the chart. One finger extended toward the corner of the supply room and stayed there, pointing at a 2-inch patch of dried dirt near the base of the shelving unit. He kept writing. The pen moved without pause. He had delivered the correction the way someone mentions the weather, informational, carrying no particular weight, requiring no particular response. Lee Caldwell looked at the corner. She looked at the mop in her hand. She mopped the corner. "Better," he said. He collected the chart under his arm and walked out of the room without once looking at her face. That was 11 in the morning. She had been at Garrett County Memorial for 23 days, and Dr. Raymond Hammond had not looked at her face in all of them. She had verified this. It was the kind of observation she made automatically, a habit installed over years of work that required precise cataloging of who was paying attention to what. The habit had remained after the work ended, the way a scar remains after a wound closes, functional in its own quiet way, not going anywhere. She returned the mop to the closet. She ran cold water over her wrists at the utility sink until her pulse settled back below 60. The water was the temperature of a mountain stream in November. She stood there until the number she needed was the number she had. Garrett County Memorial was a 12-bed critical access hospital in western Maryland, pressed into the Blue Ridge foothills like something set down by accident and never retrieved. It had been expanded twice, once in 1974 and again in 1991, and both expansions had been done in ways that made the building subtly wrong. Corridors turned at angles that did not quite make sense. Supply closets appeared in places that served no logical purpose. The family waiting area was wedged between the laboratory and the medication room, presumably because whoever had made the decision had run out of alternatives and decided proximity to both would have to be enough. 1 attending physician, 2 full-time registered nurses, a phlebotomist named Pete, who drove the county snowplow from late November through March and was reliably late returning from lunch the other 9 months, a rotating roster of nursing students from Frostburg State doing their 3rd-year clinical hours before moving on to wherever they were going next. Lee Caldwell was the current one, 3 weeks and 2 days in. Nobody at this hospital had retained her name. "You're the student from Frostburg," Donna, the charge nurse, had said on the first morning. Donna was 54 years old and had the contained efficiency of someone who had managed this floor for 17 years and had long since stopped being surprised by anything it produced. "Lee Caldwell," Lee had answered. Donna had verified the name against the ID badge, nodded once, and handed her a printed supply inventory checklist to be completed before the morning briefing. That exchange had established the terms of everything that followed, and Lee had made no attempt to renegotiate any of them. She was 31 years old. She wore her light brown hair cut short, just touching her jaw, tucked behind her ears when she was working. Her eyes were green, a pale, specific green that read as gray under fluorescent light, which she had decided was an acceptable trade. She was 5 feet 5 inches tall and compact in the way of someone whose body had spent years being reliable rather than noticed. Her blue scrubs were 2 sizes too large. She had purchased them that way deliberately. The extra fabric at the right sleeve covered the shrapnel scar on her forearm. A thin diagonal line, 7 centimeters, white against the paler skin of her inner arm, running from the outer wrist toward the elbow. The loose neckline covered the exit wound scar at her left shoulder. The general shapelessness of the outfit covered everything else that 3 years of attempting ordinary had not quite managed to hide. She had spent those 3 years constructing this version of herself with the same methodical patience she had once applied to considerably more technical problems. Quiet, forgettable, responsive without being present. Moving through rooms without disturbing them was something she had practiced until it became automatic. Her voice stayed at a low register that required slight attention to hear, which meant people who were not interested in paying attention missed what she said entirely, and that was usually fine. A neutral expression maintained with the specific discipline of someone who understands that the face is the first thing people read and the last thing you can afford to leave unmanaged. All of it, built and held deliberately. She had been trained by people for whom unremarkable was a professional survival requirement, and the training had outlasted everything else. Dr. Raymond Hammond had been the attending physician at Garrett County Memorial for 31 of his 63 years. He had formed his opinions about the appropriate hierarchy of a medical facility during an era when that hierarchy was considered not just reasonable but self-evident, and he had seen no compelling reason to revisit any of those opinions since. He addressed the female nursing staff by first name. He addressed the male radiology technician as Dr. Marsh. He had referred to every nursing student who had ever rotated through this floor as student, without exception, and he had supervised a considerable number of them. Student, bring me the chart for Bay 3. Student, room 4 is overdue for afternoon vitals. Student, there is a family in the waiting area who has been there for 35 minutes. Give them an update. She responded every single time. Chart retrieved. Vitals taken. Down to the waiting area to tell the Hendersons that Dr. Hammond would be with them shortly. Delivered in a tone that did not convey what she actually thought about the accuracy of the word shortly. Correcting Hammond would require engagement, and engagement required a presence she was not here to establish. So she absorbed the designation student with the same practiced equanimity she applied to everything else and did not correct him. It was a good plan. She was good at plans. At 1400 hours, Donna caught her in the corridor outside the medication room. Room 7, Mr. Briggs. Afternoon vitals. He knocked over his water again. Towels are in the cabinet. On my way, Lee said. The hallway to room 7 passed the nurse's station, the bulletin board, the consultation room with its persistent flickering light, and the window that looked out onto the back parking lot and the tree line. It ended at a door that was always left half open because the man inside preferred it that way. She had been in this room 6 times over 3 days, and she had noted on the second visit that the half-open door was not carelessness. She knocked twice and entered. Henry Briggs was 81 years old. His chart said hip fracture. Mechanism, a fall from an 8-foot ladder, sustained while cleaning a blocked gutter, because, as he had informed Donna on admission without audible apology, nobody else was going to do it. 3 days, admitted. His daughter had driven from Pittsburgh to sit with him and had left after 1 day because Henry had thanked her politely and told her to go home, and the word politely was doing significant work in that sentence. He was sitting up against the raised headboard. His eyes were pale blue and fixed on the doorway, with the specific settled attention of someone who made note of everything entering a room, not nervously, not with urgency, just continuously. The water glass was on the linoleum. Not broken, lying on its side. Slipped, he said. It does that. She picked up the glass, collected a towel from the cabinet by the door, and crouched to wipe the floor. He watched her hands, not the way most patients watched, passively, waiting for the room to return to quiet, but with the focused attention of someone who was measuring something, cataloging it for later. You move quiet, he said. She looked up briefly. Henry? Oh, for a person doing a job in the afternoon. He tilted his head a small fraction. Most people make more noise than the work requires. Footsteps, cabinet doors, things being set down harder than necessary. You don't. She stood. She refilled his glass from the pitcher. She wrapped the blood pressure cuff around his right arm, inflated it, read the numbers, 130/76. His pulse, 67. She recorded both. His eyes did not leave her hands the entire time. "You're the student," he said. "Lee Caldwell. Henry Briggs." He extended his right hand. She took it. His grip was completely wrong for an 81-year-old man 3 days post-fracture. It was measured and controlled and specific in a way that had nothing to do with his current situation. Military firm. The particular grip of someone who had learned to shake hands in a context where the quality of your grip communicated something real about you. She had the same grip. She was careful not to use it. "What branch?" she said, before she had quite decided to. He raised one eyebrow slowly. "You want to walk me through that?" She nodded at the scar along his left jaw. Narrow, puckered at one end, a specific pattern. Then at his free hand, which was resting near the bed rail without quite touching it, not holding it for stability, positioned near it. "Army," she said. "Infantry, not support. Korea, given your age." He regarded her for a moment, not surprised, just looking. 58th Infantry, 48 through 51. He paused. "Your turn." "Just a nursing student." He made a sound, short, dismissive, not of her, but of the answer. "Sure you are," he said. She was almost to the door when he spoke again, quietly. "Whatever you're carrying," he said, "it shows in the way you stand, not the specifics, just that it's there." She stopped. Her hand was on the doorframe. She did not turn around. "Have a good afternoon, Henry," she said. In the corridor, she stood with her back to the wall and counted her heartbeat until it was where she needed it. 58. 58. 58. Think about a time someone looked at you and saw the real thing underneath, not the version you were showing. Drop a comment below. I read every single one. When she returned to the nurse's station, Hammond was reviewing lab results. He did not look up. "Room 2 supply cabinet. 4x4s are low. Before you leave today." "Yes, sir," she said. The cabinet got restocked. Expiration dates checked on everything within reach. Thorough, quiet, unremarkable in every visible way. The drive home was 40 minutes of dark county road. Dinner made. Very little of it eaten. Lee sat at the kitchen table until the dishes were cold in the drying rack, right hand flat on the surface, the shrapnel scar catching the overhead light. And she looked at it without making herself stop. Being ordinary had never been a natural quality. Performing it was something she had gotten better at. That was all it was. She arrived the next morning at 06:15, an hour and 15 minutes before her shift. She sat in the parking lot for 8 minutes watching the first gray light come over the tree line, and then she went inside. The overnight nurse, Carol, looked up from the station desk when Lee came through the door. Looked back at her chart, said nothing. This was the correct response. This was the kind of reception Lee had calibrated herself to receive, and she operated best within it. She poured coffee in the lounge and sat at the corner of the desk and went through the overnight charts without being asked or directed. Mr. Garfield in room 8, COPD exacerbation, oxygen saturation running between 90 and 93 on 2 liters throughout the night. The post-surgical patient in room 4, doing well. Henry Briggs in room 7. Blood pressure had elevated to 148/88 at 0200, returned to normal range by 0400. Carol had noted it without calling Hammond. Call threshold was 160. She'd been correct not to call, but the spike was worth watching today. Lee wrote it on her own notepad, the one she kept in her left scrub pocket, the one nobody asked about. Hammond arrived at 0740. He reviewed the overnight summary at the station without greeting anyone, scanned the morning board and spoke without looking up. Student. Supply count before rounds. Same form. Yes, sir. The supply count took 40 minutes and covered every cabinet and every drawer on the floor. She documented accurately and submitted the completed form to Donna at 0820. Donna reviewed it, said nothing, handed it to Hammond. At 0930, a woman named Ruth Prentice arrived with her daughter, 78 years old. Confused since the previous evening, weakness in the legs. Not herself, the daughter said. And then she said it again, very not herself, which was the specific type of repetition that indicated the speaker knew they were not conveying the full extent of what they meant and was hoping the repetition would close the gap. Lee was at the linen cart near the admission desk, replacing pillowcases. She did not stop her task. She listened to the daughter's account from 12 feet away, and she watched Ruth walk across the waiting room floor. The gait was careful in the particular way of someone whose legs were doing something unpredictable, and who had begun compensating before she fully understood she was doing it. Ruth was holding her purse with both hands pressed tight against her body. Lee replaced 3 more pillowcases. Then she looked at Ruth's lips, then her fingernail beds. She went back to the pillowcases. Hammond assessed Mrs. Prentice, ordered a metabolic panel and urinalysis. Standard first response for an undifferentiated presentation in a woman of that age. Lee put the linen cart away and prepared Mr. Briggs's scheduled medication and brought it to room 7. Henry was awake. He took the pill without comment, handed back the cup. "You were early this morning," he said. "I came in early," she said. He watched her face. "Couldn't sleep?" "I sleep fine." "I didn't ask if you slept. I asked if you could." She wrote the medication confirmation in the log. She checked his wristband against the label. She did everything in the correct sequence. 3 years, she said, not an answer to anything he had said recently. He waited. "Since I left." She set the medication log on the tray table. 3 years. Hard exit or planned? She considered it. Planned, but not ready. She picked up the log. "I'm always ready for the decisions I make." "That's not what ready means," he said, gently. Not as a correction, as a distinction that mattered to him. She left before she had an answer. In the hallway, she heard Donna's voice carry from the nurse's station. "Sodium is 118, doctor." She stopped walking. A pause. Then Hammond. "You said 118. "Yes, sir." Lee's hand went to the wall. She had no memory of doing it. 118. Severe hyponatremia, the careful walk, the grip on the purse, the confusion since the previous evening, the pale color at Ruth's lips in the waiting room light. It assembled in less than 2 seconds, clean and complete. The way a diagnosis assembles when you have seen enough of a particular picture to recognize it from a corner. What came next had a narrow margin. Rapid correction of severe hyponatremia caused osmotic demyelination syndrome, irreversible neurological damage. The protocol was slow and precise. A controlled rise in serum sodium, no more than 6 to 8 milliequivalents per liter in any 24-hour period. She needed a specific fluid calculation, central line access, and someone to check that calculation against her own. Her right hand was flat on the wall. She was aware of her own breathing. She was a nursing student. Hammond had 31 years in this building, and a valid license, and every professional authority this situation contained. She removed her hand from the wall. She walked back to the station and stood at the far end of the counter and watched him work through it. He ordered the correct fluid. He calculated the correction rate, and it was appropriate. He was cautious, and he was, in fact, competent. And the plan he dictated was the plan she would have dictated, and everything was under control, and she was not needed. She stood at the counter. Donna looked at her from across the station, held the look for 1 second, looked away. "Have you ever known exactly what needed doing, seen it clearly, and had to hold yourself back anyway? If you have, you already know what that costs. Hit the like button. You know why." At 1400, she went back to room 7. Henry had a paperback on the blanket beside him. He put it face down when she came in. His eyes went to her face and stayed there. "The woman they admitted this morning," he said. "She going to be all right? How did you know about her?" He tapped the wall beside the headboard. "Old building, old ears." She wrapped the BP cuff around his arm. 136/82. Slightly elevated, same as yesterday. "The doctor is managing it correctly," she said. "That wasn't what I asked." She recorded his pulse. "She's going to be fine. The protocol is appropriate and it's underway." "Good." He watched her roll the cuff. "I had a company commander in Korea. Man named Briggs, same name as me. No relation, different county entirely. He used to say that the most dangerous thing you could do to a capable soldier was make them stand in the back of the room for too long." She clipped the chart to the board at the foot of the bed. "He wasn't talking about the soldier," Henry said. "He was talking about what happens to the room." She looked at him. He looked back. No urgency in it. The patience of someone who had long since stopped spending energy on things that were not worth the investment. "Air Force," she said. Quietly. Not the way she'd said it yesterday, as a slip, a moment she hadn't quite managed, but as a choice. Small. Deliberate. Like setting something down. Henry nodded once, not pressing for more. "Thank you," he said. "The way you say thank you when someone has given you something they weren't required to give." She left his room and stood in the hallway outside his door and breathed in the antiseptic and old wax smell of the corridor, and did not move for a moment. The drive home took 40 minutes. Dinner made, barely touched. At the kitchen table with her right hand flat on the surface and the shrapnel scar visible under the overhead light, she looked at it without making herself look away and thought about what Henry had said about the room. At 0400 she gave up on sleep entirely, got dressed, and drove back in the dark. She sat in the parking lot with the engine off and watched the hospital and thought about nothing she could name precisely, which was not the same as thinking about nothing. She was completing incident report forms at the nurses' station at 1347 when the sound reached her, not consciously at first. A vibration below the threshold of the fluorescent hum, something that arrived through the soles of her feet before it came through the air. A low, synchronized pulse with the specific density of heavy diesel engines running in formation. Her pen slowed on the form. She counted the intervals. 3 vehicles, minimum, possibly 4. Moving fast and not decelerating. The pen went down on the desk, up, to the end of corridor window without hurrying, because hurrying was something you did after you had confirmed what you were dealing with, and before you committed to a course of action, not before either. Through the glass, the small parking lot, the county road beyond it, the low ridge line of Blue Ridge Pine, and 3 black military transport vehicles coming around the bend with the coordinated compression of a convoy that had a destination and no patience for the speed limit. No lights, no sirens, nothing announcing itself. Just the vehicles and the fact of them. "Is that the military?" Donna said, appearing behind her. "Yes." "Why would they come here? Should I be calling someone?" "Call Hammond right now." Lee was already turning away from the window. "Tell him blast injuries, mass casualty protocol, number of casualties unknown, arrival in under 90 seconds. How do you know there are blast—" "Call Hammond," she said, "right now." She walked to the supply room. Fresh gloves pulled on. Standing in front of the trauma cart for a moment. The specific layout of it, the way the supplies were organized, the exact reach of each section, and then one step back from the cart. Hands into scrub pockets. Nursing student. Present to observe and assist under supervision. Back against the door frame, waiting. The front doors came open 51 seconds later. 4 men came through them, the way people come through doors who have done this in considerably worse conditions than a critical access hospital in Western Maryland, and are treating the current situation as the simplest version of a thing they have performed many times. Large men, moving in the synchronized compression of a unit that communicated in fractions rather than sentences. They were covered in the fine red-brown dust of a training range. Their boots, their plate carriers, the creases of their gear, the tactical vests that had been built entirely for function and showed it in every worn seam. They were carrying a litter, 2 men on each side. The man on the litter was alive, but not by a margin that could sustain itself without immediate intervention. The lead man was not the largest of the 4, but he was the one the room organized itself around without instruction. He came through the door with a single sweep of the space: floor plan, personnel, exits, equipment, capacities. All of it taken in before the doors had fully finished opening. He was perhaps 40, a jaw like the end of something dense and durable. 3 days of beard coated in the same range dust as his boots. "Clear me a bay," he said. Not loud, not a demand in the way that required volume, informational. The kind of statement made by someone who has delivered it before in contexts where compliance was immediate and universal. Chest decompression and femoral arterial control. Right side chest, left leg. Get your doctor now. Donna was already reaching for the phone. Hammond was already coming down the corridor. Donna's earlier call had moved him, and he stopped when he registered the 4 men and the litter and the specific atmosphere that entered a room with people who had come from somewhere bad. He stopped. He looked at the litter. He said nothing for 2 full seconds. "Bay 4 is open," Lee said. "From the supply room doorway." Flat. No inflection. Not stepping forward. Not claiming anything. Information only. Hammond looked at her. Donna looked at her. The lead operator turned and looked at her. She kept her eyes on the patient. She had been looking at the patient since the doors opened, building the picture as they moved through the room. The tourniquet on his left thigh was a cat, applied as high as anatomically possible, groin adjacent, which meant the injury was likely at or near the femoral origin. The windlass had been twisted past the standard stopping point, indicating that the field medic had not achieved adequate occlusion on the initial application and had corrected forcefully. That tourniquet had been on long enough for the distal limb to show it. That needed addressing. But the chest was what was killing him on the clock she was running in her head. Trachea deviated to the right, visible at this distance. Absent breath sounds on the left side, confirmed by the fact that she could see his chest moving unevenly from 10 feet away. Tension pneumothorax. The needle and the chest tube were the distance between this man and the end of the margin. She kept her hands in her pockets. Hammond directed the team toward Bay 4. Donna moved the crash cart. The 2 floor nurses who had materialized from their stations began the controlled scramble of a small hospital being asked to operate at a capacity it was designed to handle in theory, but rarely encountered in practice. The operators moved their patient with the efficiency of people who had cleared their own paths in worse rooms than this one, and the lead man was coordinating his team in quiet bursts of specific language as he moved. He swept the hallway again. The automatic sweep, the kind that does not stop until it has accounted for everything present. It reached the supply room doorway. It slowed. Lee was against the frame, hands in her scrub pockets, eyes on the patient as the litter moved past her. Tracheal deviation rate tracked against a time estimate. Tourniquet distal tissue color tracked against a compression duration. Not looking at the lead operator, doing the specific type of not looking that is indistinguishable from looking to anyone who knows how to read it. His sweep stopped. The team kept moving. His body kept moving with it, momentum carrying him forward. But his eyes stopped on her and did not continue. They went to the blue scrubs 2 sizes too large. The short light brown hair, the compact stillness of someone standing against a doorframe in a crisis who is not doing nothing but who is choosing not to do something. And the distance between those 2 things is visible to exactly the people trained to see it. Something crossed his face that was not the expression of a man looking at a stranger. He took 2 more steps. His team was through the bay door. He stopped in the corridor with 6 feet of linoleum between himself and the woman in the supply room doorway, who was watching his casualty through the bay window with the focused, technical expression of someone reading a situation they have read before. He looked at her. He looked at the blue scrubs. He looked at the way she was positioned, not hiding, not observing, but holding herself at the boundary between those 2 things with a precision that required more practice than nursing students accumulated. He opened his mouth. He did not say her name. He said the other one. Angel. Not a call across a distance. Not a question. A direct address, delivered at a normal speaking volume, to a specific person in a specific room, using a name that had not been spoken in this woman's direction in 3 years and 4 months. The corridor went quiet. Donna's hand stopped on the crash cart. Hammond turned from the bay door. The 2 floor nurses looked up from their tasks. Through the bay window, the 3 other operators registered their team leader's position and followed the line of his attention to the doorframe where the nursing student stood. Nobody moved. Nobody spoke. Lee Caldwell stood against the frame with her hands in her scrub pockets and her face completely still. Henry Briggs had told her that whatever she was carrying showed in the way she stood, even if he couldn't see what it was. She thought about that for 1 second. Precisely one. Then she looked at the man on the litter through the bay window. She looked at the tourniquet and the tracheal deviation and the monitor that Donna had just managed to connect, currently displaying a heart rate of 126 and a blood pressure of 82/48, and a trend line that was going somewhere nobody in that bay had the training to follow it. She looked at her hands. If you have ever heard your old name called from a room you thought you had left behind for good, you already know exactly what the next 3 seconds feel like. Stay right here. This story has not finished yet. Lee took her hands out of her pockets. The moment Lee took her hands out of her pockets, something changed in the hallway. Not loudly, not dramatically. Just the specific atmospheric shift that occurs when a person who has been choosing not to occupy a space steps into it fully, and every conscious person in the vicinity registers, even without naming, that something fundamental about the room has altered. Decker saw it happen. He had spent 22 years learning to read exactly that shift in people, because in his profession, the ones who couldn't make it reliably tended not to last, and the ones who could were the ones you built everything else around. Excuse me, Lee said, not to Decker, to Dr. Hammond, who was standing in the bay 4 doorway with one hand on the frame and his face carrying an expression somewhere between authority and the first edge of uncertainty. Lee moved past him without touching him, and Hammond stepped aside without quite deciding to. The way people step aside for something that has already made the decision for them. Inside Bay 4, the 3 other operators had Petty Officer First Class Eric Tanner positioned on the bay bed with the litter removed and the equipment arranged in the specific improvised order of men who know how to work in bad conditions and have done the best they could with good ones. Tanner was 29 years old according to the tactical identification on his vest. His color had moved from bad to worse in the 90 seconds since they'd come through the doors. Tracheal deviation, still right, increasing. Blood pressure on the portable monitor, 79/44. Heart rate, 131 and climbing. Oxygen saturation, 81%. The chest would kill him before the leg did. The chest would kill him in the next 4 minutes if nothing changed. Lee pulled gloves from the box on the crash cart without looking at the box. The box was where she knew it would be. That cart had been inventoried on her 3rd day at Garrett County Memorial and verified every morning since, the kind of automatic habit drilled until it preceded thought. Looking at Tanner now, she catalogued his chest wall. The visible asymmetry of the breathing effort, the paradoxical motion on the left side indicating absent lung expansion, the distended jugular veins confirming the pressure differential building inside the pleural space. 14-gauge angiocath from the crash cart. What is she doing? Hammond said from the doorway. Not aggressive, genuinely uncertain, as though the question was for him as much as anyone. Tension pneumothorax. Lee's voice was flat and factual. Needle decompression, then tube. I need a 32 French chest tube tray and a pleurovac assembled. Donna. She said the charge nurse's name without looking away from Tanner's chest. Donna did not move immediately. She was standing at the edge of the doorway with an expression that had not resolved into anything recognizable yet. The gap between the nursing student who had restocked her supply carts for 3 weeks and the person currently giving instructions in Bay 4 was producing a visible cognitive error. Donna. Lee said the name again. Same volume, Different register. Low. Absolute. The specific frequency of someone who has delivered this category of instruction before in conditions that did not tolerate delay. The tray. Now. Donna moved. Hammond stepped forward. I am the attending physician. You are not authorized to perform. Sir? Decker's voice from the doorway. Not raised, not aggressive, entirely final. Step back. Hammond turned. He had not been told to step back in his own facility in 31 years of practice, and his face registered this fact completely. Decker was looking at him with the level patience of someone who will wait exactly as long as necessary for the correct decision to be made, and not a second longer, and who has waited in considerably worse situations than a 12-bed hospital in Western Maryland. Hammond stepped back. Lee was already at the patient. She found the second intercostal space on the right side of Tanner's chest at the mid-clavicular line. 2 fingers on the skin, palpating the intercostal margin, confirming the anatomical landmark with the specific certainty of someone who has performed this procedure in conditions that included darkness, moving vehicles, and active enemy fire, and has never had the luxury of getting it wrong. Hold his shoulders, she said. One of the operators moved without being asked twice. He had the shoulders. His partner took the hips. They had done this before, the positioning. She could see it in how immediately and how correctly they moved. She drove the needle in. The hiss of decompressing air was immediate, pressure-driven, escaping the catheter with enough force to confirm what she had already assessed before she made the first move. Pink-tinged froth, tension. She removed the needle, left the catheter in, taped it at the hub. The trachea shifted, 2 millimeters, visible at the anterior midline. Beginning. On the monitor. Oxygen saturation 84%, climbing. Heart rate 124, starting down. Tube tray, she said. Donna was already there, sterile packaging open. The 32 French presented and ready. Lee looked at the tray for 1 second. Force of habit, the confirmation scan drilled into her so thoroughly that it preceded action regardless of context. And then her hands were moving. 5th intercostal space, left side, anterior to the mid-axillary line. She made the incision, fast and clean, the blade finding the space with the confidence of a hand that has made this incision before in field conditions that made a well-lit rural hospital feel like an operating theater. Dark blood welled immediately, scalpel down. Kelly forceps into the incision, the deliberate, ugly violence of tissue spreading, the procedure that looks like damage and is repair, the sight of which had caused Hammond, visible at the edge of her peripheral vision, to go very still. The room held its breath. She swept one gloved finger into the space, the confirmation pass, clearing clots, verifying anatomy before the tube went in. And Tanner groaned, deep, guttural. The sound of a person whose body has just been reminded it is still fighting. He's with us, one of the operators said, quietly. Lee placed the chest tube, 32 French, aimed posterior and superior, fed past the first resistance and then into position. Dark blood moved immediately through the tubing. She connected the pleurovac. The machine engaged, pulling air and blood from the space that had been collapsing since the ordnance went off. "Sats," she said. The floor nurse at the monitor, a young woman named Amanda who had been standing in the doorway of Bay 4 for the past 3 minutes not breathing at normal intervals, looked at the screen. 91, 92, 93. Heart rate, 114, 112. Blood pressure, 86/52 on the next reading. Not good, but moving in the right direction. He needs surgery for the femoral, Lee said. She was stripping her gloves. She was looking at the tourniquet on Tanner's left thigh. The cat, high and tight, windlass past standard, applied by someone who knew what they were doing. This stabilizes the chest long enough to transport. Femoral is compromised at the inguinal region. He needs a level 1 OR and a vascular surgeon within 45 minutes. What's your medevac ETA? Bird is 8 minutes out, Decker said from the doorway. He had his radio in one hand. He was looking at Lee with an expression she did not look at directly. That's fine. Continuous vitals until touchdown. That tourniquet checked every 10 minutes. If SATs drop below 88 after the tube, call me. She looked at one of the operators. You'll stay with him until the bird lands. Yes, ma'am, he said, without hesitation, without irony. Lee walked out of Bay 4. The corridor was completely still. Donna at the station, Hammond against the wall, the 2 floor nurses frozen in the doorway to room 3. All of them looking at the woman in the blood-stained blue scrubs who had just performed 2 advanced trauma procedures in under 5 minutes in a 12-bed critical access hospital and walked out of the bay the way you walk out of a room where the work has been done. Nobody spoke. If someone you love has ever been saved by a pair of hands that refuse to stop, you know exactly why this matters. Hit that like button. This one is for them. Lee walked to the sluice room at the end of the corridor. The door opened on an elbow push. Faucet on, hands under the water, scrubbing until the drain ran clear. The sluice room door opened 40 seconds later. Decker came in the way a large man enters a small room when he is conscious of its size, sideways, staying near the door, not advancing into the space. He smelled like range dust and the specific sweat of someone who had been under operational stress since before noon. He looked at Lee at the sink. He looked at the water running over her hands. Dispatch pulled your student registration when we were routing to the facility, he said. Lee Caldwell, Frostburg State, 3rd-year clinical rotation. I almost missed it. He paused. You changed your name. I didn't change it. Her eyes stayed on the drain. I used my mother's maiden name. I've always had both. Angel. He said the call sign the same way he'd said it in the hallway. Not a question. The confirmation of something that had been waiting to be confirmed. 38th Rescue Squadron, Moody Air Force Base, PJ, 5 years active duty, separated 2021. He paused. You were the best combat rescue operator I ever saw work, and I've worked with a lot of them. The water ran. The drain was clear. She kept scrubbing. We were running a joint exercise at the Valley Training Range, Decker said. Live ordnance breach from an adjacent sector shouldn't have been possible and was. Tanner took frag to the chest and leg and was down inside 30 seconds. I had 2 options, base hospital, 24 minutes, or this facility, 12. Then dispatch flagged a name attached to a PJ service record, and I made the call. He let that settle. It was the right call. You didn't know I'd step forward, she said. No, he said. I didn't. A pause. But I know what a person looks like when they're making themselves stand in the back of the room. And I know what they look like when they stop. The water ran. She turned it off. She stood with her hands on the rim of the sink. I left for a reason, she said. I know the reason. Then you know I can't. I'm not here to recruit you, Decker said. I'm not asking you to re-enlist, recertify, or go back to anything. I'm telling you a fact and I'm letting you do what you want with it. He was quiet for a moment. Sean Riggs. The name landed in the room before she could prepare for it. It landed the way certain names land, without permission, bypassing every defense, going directly to the place where the defense was built in the first place. Lee said nothing. The sink rim was cold under her hands. He made it through everything, Decker said. After Kandahar, after the evac you coordinated, he recovered fully. Finished his service, separated 2 years before you did. Decker's voice was level, but there was something deliberate about the levelness, the specific control of someone delivering something that required care. He went civilian, became a wildland firefighter, hotshot crew in Montana. 8 months ago, a snag tree came down wrong during an evacuation operation. He was extracted but didn't survive transport. Lee's hands tightened on the sink. 8 months ago. She had been 40 minutes from this hospital, in a Frostburg State classroom, learning the proper procedure for documenting a routine medication pass. She had been invisible and unreachable, and exactly as protected from the world as she had designed herself to be. And Sean Riggs, who had survived 2 combat deployments and a helicopter crash and the specific kind of recovery that takes years and costs everything, had died in a Montana field, and she had not known. Because she had made herself the kind of person who could not be found, and being unfindable had been the point. She had not been there. He used to say I was terrible at pretending, she said. Her voice was not steady. She did not try to make it steady. He was right, Decker said. He said it gently. He would have laughed at this. She gestured at the supply room door, the corridor beyond it, the blue scrubs, the mop, the supply carts, the invisibility routine. Probably. He always said I had the worst poker face he'd ever seen on a PJ. Decker was quiet. She stood at the sink for a long moment. The antiseptic smell of the room, the drip of the faucet, the distant sound of the medevac helicopter beginning its descent to the hospital lot. She could feel it in the floor before she heard it properly, that same low vibration she had felt 3 days ago from the convoy, and her body registered it with the same precise internal response before her mind caught up. She breathed in. She breathed out. "Thank you," she said, "for telling me. You didn't have to." "No," he said. "I didn't." He reached into his vest and set a card on the edge of the sink. Plain white, a single number in black ink. "That's not a job offer. It's a contact. People who speak the same language if you ever want to talk." He paused at the door. "Tanner would have been dead before the bird landed. You know that." He left. Lee stood in the sluice room with the card on the sink edge for 3 minutes. Then she walked back into the hallway. Hammond was at the nurse's station. He looked up when she came out of the sluice room door. He looked at her blood-stained scrubs, the dark spray across the front, the wrist-to-cuff staining, with an expression she had not seen on him before, not diagnostic, not authoritative. Just a man registering what he was seeing and processing it against what he had previously assumed. "The needle decompression," he said. "Second intercostal space, mid-clavicular line." "Yes, sir." "Correct placement." He was not asking. He was verifying something he had watched. "And the tube, 5th space, anterior mid-axillary." "Yes, sir." He looked at her for a long moment. The chart in his hand was not being read. He was looking at Lee Caldwell with the specific expression of a man who has operated inside a fixed understanding of something for a long time and has just encountered information that requires him to rebuild it. "What branch?" he said. "Air Force. Pararescue." He nodded once, looked down at his chart, wrote something, looked up again. "We have spare scrubs in the supply room, your size." He paused. "You should replace those before the next shift." It was not an apology. It was nowhere near an apology. But it was the specific acknowledgement of a man who does not have the vocabulary for what he means and is saying the next available thing to it. And she understood it, and she accepted it. "Thank you, Dr. Hammond," she said. "Supply room. Fresh scrubs from the shelf, her size." Standing in front of the mirror above the utility sink for a moment. The short hair, the pale green eyes that read gray under fluorescent light. The face 3 years of careful work had made unreadable. Sean Riggs was dead. Henry Briggs had said, "Whatever you're carrying, it shows in the way you stand. In, out, down the corridor to room 7. Has someone you lost ever come back to you? Not as a ghost, not as a dream, but as something they left inside you that you didn't know was still there? If you know what that feels like, stay with me. The hardest part of this story is just ahead." Henry was in bed with the overhead light off and only the small reading lamp on, casting the room in a low amber that was different from every other afternoon she had been in here. She noticed it before she cleared the doorway. He had asked for less light, which sometimes meant pain, sometimes fatigue, and sometimes the specific economy of a person who has started making decisions about what deserves their energy. "You saved that boy," he said when she came in. His voice was quieter than yesterday. "He's stable," she said. "Medevac took him 40 minutes ago. He'll be in surgery by now. I heard the helicopter." He was watching her face with the same attention as always, but the energy behind it was different, careful in a new way, as if he was measuring how much to say. "You all right?" She pulled his chart from the board. Afternoon vitals from Donna. Blood pressure, 146/88. Elevated. Pulse 76, but with a notation beside it. Irregular rhythm noted. Query arrhythmia. Labs flagged for morning. She looked at the notation for a moment, then set the chart back. "Someone I served with died 8 months ago," she said. "I found out today." Henry said nothing. He did not reach for a response. He understood what silence was for, which was one of the things she had come to value about him over 3 weeks of short hallway conversations and afternoon vitals. "I made myself unreachable," she said. "I thought I was protecting people. I was hiding." She stopped. "I missed it. His death. I missed the whole thing." "Yes," Henry said. Quietly. Not cruelly, just accurately. She sat down in the chair beside his bed, something she had never done before, had always stood, clipboard in hand, maintaining the professional geometry of student and patient. She sat without the clipboard. Henry closed his eyes. His breathing was even but slower than it had been. His chest rose and fell with a deliberateness that was new. "You're going to be all right," he said. "Don't know that," she said. "I do." He opened his eyes briefly. The pale blue, steady and direct. "Good night, Lee." She sat beside his bed until he was asleep. Then she walked back to the station and wrote up the day's incident forms and did not think about the card sitting on the edge of the sluice room sink. She thought about it anyway. The internal phone rang at Aero 217. Lee had been at the nurse's station for 2 hours by then, having come in again before her shift. Having told Carol she would take the early hours, having been silently grateful when Carol accepted without asking why. She had been filling in the overnight incident log and not sleeping, which was not a new condition, only a more honest one now. Carol picked up the phone, listened for 4 seconds, said, "I'll get her," held it out. "Room 7, Carol said. Lee walked the corridor without hurrying. It was the specific, unhurried pace of someone who has learned, through repetition in difficult places, that the speed of your approach changes nothing about what you find when you arrive. Henry's room was quiet. The reading lamp was off. Only the monitor glow. His breathing was audible from the doorway, shallow and rapid, with the labored quality of a respiratory system working against increased resistance. His color was off in the monitor light, pale at the lips and fingertips, a gray undertone to his cheeks that had not been there yesterday afternoon. She checked his pulse. Irregular. A fast, slow, fast pattern under her fingers that she recognized and that confirmed what Donna's afternoon notation had flagged. She looked at the monitor display. Heart rate variability was significant. The tracing showed the chaotic rhythm of new-onset atrial fibrillation, not the chronic, managed kind, but the acute, destabilizing kind that in an 81-year-old man, 3 days post-hip fracture with an uncharted cardiac history, carried a specific category of risk. She reached for the phone. His hand closed on her wrist. "Lee," he said. She stopped. His grip was the same as always, measured, controlled, specific. Weaker than yesterday, in a way he had not tried to hide. "I know what this is," he said. His voice was quiet, completely calm. "I've been around long enough. Henry." She kept her hand on the phone. "I'm calling for a transfer. They can manage the arrhythmia at a cardiac facility. It's manageable. Maybe." He looked at her. "Sit down first." She looked at him. She sat down. He was quiet for a moment, working through a breath that took longer than it should have. The monitor beeped its irregular rhythm. Outside the half-open window, the Blue Ridge darkness was absolute, no moon visible, only the very faint suggestion of the tree line against a slightly lighter sky. "My daughter wanted to stay," he said. "I sent her home because she was afraid. She loves me completely. but she was afraid of this. He moved his free hand slightly toward the monitor, the room, the specific situation. Afraid of being here when it got hard. And I couldn't have that in the room with me. "Henry, you're not afraid of it," he said. Not a compliment. A fact he was stating because it was relevant. "You've been in rooms like this before. Not this room, but this situation. Someone who needs to be accompanied through the hard thing." He paused for a breath. "You know how to be present for the hard thing. That's rarer than people think." "I'm afraid," she said. "I'm afraid right now." "Not of this," he said. "Not of being with someone when there's nothing to fix. You can sit with that. Most people can't." His hand tightened slightly on her wrist. Not urgent. Just there. "Stay a minute." She took his hand in both of hers and she stayed. His breathing was slow. The monitor displayed the arrhythmia in its wavering green line, irregular but not yet in a configuration that meant immediate collapse. He had time. Not a lot of it, and not the kind that stretched forward without end, but enough for what he was using it for. "My CO in Korea," he said. "Briggs, the other one, not me. Different county entirely. He used to tell us that the bravest thing a soldier could do wasn't charge a hill or hold a position." A long breath. He said it was to stay with someone, even when there was nothing left to do, even when staying didn't change the outcome. A pause. He said staying was its own kind of valor. "He was right," she said. "Yes." Henry's voice was quieter now. He usually was. The pale blue eyes in the monitor glow, still sharp, still seeing. "You're going to be fine, Lee Caldwell. You don't know that." "I know what a broken person looks like," he said. "I've been looking at them for 81 years. You're not broken." A breath. "You're just carrying something heavy. There's a difference." The monitor tone shifted at 0304. Not a flat alarm. A sustained single note, low and steady, replacing the irregular rhythm that had been there before. Lee looked at the screen. The monitor tone. Henry's face. The stillness that had settled across both. Her hand stayed in his. She sat in the chair beside Henry Briggs in the low glow of the monitor and held his hand and breathed and did not look away from any of it. 7 minutes. Then she stood. Lee smoothed the blanket at his side. Up to silence the monitor. A moment at the foot of his bed, looking at the man who had seen her clearly in a building full of people who had not bothered to look. The nurse's station. Time written in the log. 0304, 0304. She called Donna's overnight emergency line and reported the death in clear clinical language, and she listened to Donna's response, and she said she would remain on site until the morning shift. Then she stood in the corridor outside room 7's door and looked at the darkness inside. Sean Riggs had died in a Montana field she had never seen, and she had not known. She had been invisible and unreachable by design, and her design had cost her the chance to grieve him with the people who knew what he had been. Henry Briggs had died in a room she had mopped herself 3 weeks ago, and she had been present, and she had held his hand, and he had known someone was there. She could not have one. She had been given the other. The mathematics of that sat in her chest like something lodged. She walked to the sluice room. Decker's card was on the edge of the sink where he had left it 8 hours ago, untouched until now. Lee picked it up and stood under the fluorescent light and looked at it. Plain white, one number in black ink, the weight of it nothing. The weight of what it represented something she did not yet have the words for. Into the scrub pocket. Back to the nurse's station, corner chair, clipboard and incident forms, and the fluorescent hum above her. The lesson she had been running from for 3 years and 4 months was this: you cannot save everyone. There is no version of enough that ensures it. People die in fields you never see, in moments you are not present for, on tables where your hands cannot reach. Some of that is distance. Some of it is time. Some of it is the simple, irreducible fact of being one person in a world that does not pause to accommodate that limit. The not knowing is not failure. It is what it is to be human and finite and unable to be everywhere at once. But you can show up for the people in front of you. You can take your hands out of your pockets. You can sit in a chair beside someone at 200 in the dark and hold their hand and refuse to look away from the hard thing. You can walk into a trauma bay and do the work that your hands know how to do. You can let someone see you, the real version, not the performed one, and trust that it will not destroy you. All of that had happened today. Tanner, alive somewhere in a Baltimore operating room because she had stepped forward. Henry, not alone when it mattered because she had sat in that chair. Not the fixed version of heroism, not the version with lights and running and shouted commands. The other version, quieter, harder, the refusal to look away. The morning shift arrived at 6:30. Lee gave handoff to the arriving nurse, thorough, specific, each patient by room number and current status. And she gathered her bag and her clipboard, and she walked the corridor toward the exit. She stopped at the supply room door. She looked in at the mop in the closet, the shelves she had inventoried, the supply carts she had restocked, the corner in the back where Hammond had pointed his finger 6 weeks ago without looking at her face. She closed the door. She walked on. In the parking lot, the morning air was cold and tasted like pine resin and elevation. Her car sat under the broken light post where she had parked it on day one because that spot was at the edge of the lot, furthest from the entrance, least visible. The habit of a person who had spent a long time choosing the position least likely to draw attention. She stood beside the car and looked up at the hospital. 12 beds. 1 attending physician. The window of room 7, dark now, curtain drawn. She pulled Decker's card from her scrub pocket, looked at it in the early light. The number in black ink, the plain white background. Go back to Frostburg. Complete the clinical hours, submit the paperwork, become a civilian nurse in a civilian building, invisible until she died, and skilled enough at the performance by now that it might even hold. Or she could figure out what came next for a person who was both things simultaneously, the one trained in darkness to pull people out of fire, and the one who had spent 3 years trying to wash that off in a hospital sink and discovered that it did not wash off, and had stopped trying. There was no good version of this day. Henry Briggs was gone. Sean Riggs had been gone for 8 months and she had not known. Those two facts sat in her chest at the same weight, and they were going to sit there for a long time, and she was not going to pretend otherwise. But Tanner was alive, and Henry had not been alone, and she had not looked away. The sun came over the Blue Ridge ridgeline as she stood there. The specific slow appearance of it above the hills. The way the light spread across the parking lot gravel and the hospital wall and the dark window of room 7 and all of it simultaneously. Indifferent and complete, and making no distinctions. Lee looked at the card one more time. The car. The card stayed between her fingers. Not put away, not set down. Held the way you hold something you have not yet decided what to do with, which is different from something you intend to put down. Lee drove out of the parking lot and onto the county road. The road ran east toward the morning light. The hills opened up on either side, the Blue Ridge spreading wide and green and permanent, and the sky above them was the specific pale gold of very early day, the kind that does not promise anything, but does not take anything away either. Lee Caldwell drove into it. The end. If this story stayed with you, if Lee's courage and Lee's grief meant something, please subscribe to this channel, hit that like button, and leave a comment right now telling us where you are watching from. Every single comment is read. Every single one matters.